Welcome. In this video we're going to go over the skull. We'll start with the cranial bones and the sutures. In order to make the skull a bit more manageable, we'll break it into cranial versus facial bones. Cranial bones, think of them are anything that surrounds and protects the brain, and the facial bones are those that give you your facial features, so it gives it shape and structure. You will be expected to look at a diagram like this and be able to identify which numbers are cranial bones and their names, and which bones are facial bones and what their names are as well. We will see bony markings on some of the bones. Others will not have any bony markings at all, but others might have up to 3 or 4 different bony markings that you would have to identify. An overview of the cranial bones. Some of these might be familiar to those of you who have taken psychology, especially AP psychology, because they match the lobes of the brain. So we have a frontal bone, parietal bones, meaning that there's one on each side. The temporal bone is also a paired bone, so there's an individual temporal bone on each side. Their size and shape mimic each other, so we would say that they're both temporal bones. And the occipital bone is the base of the skull. The 2 trickiest ones are the sphenoid bone and the ethmoid bone. They're harder to visualize. The sphenoid bone right now just looks like a small, odd-shaped bone, and the ethmoid looks like a little rectangle, but we'll look at those individually and see what they look like. The frontal bone, I feel you'll be comfortable and confident identifying this right away. It's your forehead. It matches with the regional term for frontal region, that frontal bone, so it forms your forehead as well as your upper eye sockets. Parietal bones, you're looking right now at the right parietal bone. It would be the same on the left side. This one forms the majority of the roof of the cranium. The occipital bone is the base of the skull. So it forms the floor. We flip the skull over to look at the inferior view. The occipital bone has 2 different bony markings that you will be expected to know. The foramen magnum. At this point you understand that foramen means hole, magnum means large. So foramen magnum is a large hole. This hole is for the spinal cord to go up to the brain. The other bony marking or markings would be the occipital condyles. Condyle is a repeated term. It means a point where 2 bones articulate. The condyles of the occipital bone will be knuckle-like protrusions that articulate with the atlas of the cervical vertebrae. So cervical vertebrae number 1, remember, lacked a body, and it's there to provide you with the rotational movement of the head. What rotates on it are these occipital condyles. The temporal bones are of the temporal region, so imagine if you have a bad headache, you would rub your temporal region. They're paired, similar to the parietal bone, so there's one on your right side as well as your left. On the temporal bone, there are 4 different bony markings. The first is the external acoustic canal. The acoustic canal means that it's going to be a part of your ear, so acoustic refers to sound. Canal has a passageway within it, so it looks like a tiny little ear where your ear would be. Mandibular fossa. Fossa is another repeated term. Think of supraspinous fossa, infraspinous fossa, subscapular fossa, the pieces where you could put your finger in and swoop it back and forth. The mandibular fossa is a fossa for the mandible. So it's on the temporal bone here, but it's the fossa in which the mandible, the jawbone, will fit. Styloid process, we saw styloid processes on both the radius and the ulna. We see another one on the temporal bone. Very similar to the styloid processes on the radius and ulna in terms of shape. This one, instead of limiting motion, it's going to have muscles and ligaments that will attach to the hyoid bone. The hyoid bone is a suspended bone. It doesn't articulate with any other bone. The purpose of the hyoid bone, just for curiosity's sake, is for muscles to attach that control your tongue. So when we talk about the muscular system, some of the muscles we talk about in the face will be connected to the hyoid bone, especially those that control the tongue. The last bony marking is the mastoid process. So it has the ending of process, similar to the styloid processes, but it's a mastoid because it's just a larger mass. The styloid processes were more like styluses of a pen. They came to a finer point. The mastoid process is the larger lump. Muscles will attach here and allow for rotation and turning of the head. The sphenoid bone is best seen when we've done a transverse section through the skull, and we're looking now at an inferior view of the skull, and we can see that the sphenoid bone is this large piece. It goes from right side all the way over to the left side, so it's a singular bone, and it has a bat-like shape. The bat-like shape makes it easier to recognize, but the only way that you can see the bat-like shape is if you've done the transverse section and you're looking down at the inferior view of the skull. There is one bony marking to know within the sphenoid bone, and that's the sella turcica. Sella turcica means Turk's saddle, and the purpose of the sella turcica is to protect the pituitary gland. The pituitary gland is a piece of the brain, so a gland within the brain. It's a little like sac-like shape that hangs down, and it sits within this Turk's saddle for additional protection. The final cranial bone is the ethmoid bone. In order to see the ethmoid bone, you look through the nose. Okay, so where the nose would be, you look through there, and it's where it's green. You can also see little pieces of the ethmoid bone through the eye sockets, as well as in this horizontal section. This horizontal section gives us the one bony marking that you can know on the ethmoid bone, and that's called the cribriform plate. The purpose of the cribriform plate is to allow passageway for olfactory nerves, nerves that bring in the sense of smell. I think of a plate of food. A plate of food would give off a lot of smell, and that sense of smell would travel through the cribriform plate up into the brain. It's only seen through this horizontal section, so this tiny little piece is the ethmoid bone, visible. It's not visible through this anterior view because the cribriform plate would be somewhere up within the skull, so behind that frontal bone or in between it. Here's a disarticulated look at the sphenoid and the ethmoid bones. Disarticulated means that all the other bones have been pulled away so that you can just see the bones as individual pieces. The sphenoid bone with its bat-like shape all the way from the right side to the left. The sella turcica would be in this area. It's a blurrier picture. The ethmoid bone has an appearance kind of like a pecan or a walnut, I think, because of these like the perpendicular plate and then the different conchae. The cribriform plate would be up here, and this crista galli is referred to as the hook for the brain. So it's a small protrusion off of the ethmoid bone that hooks onto some of the connective tissues of the brain and holds it in place. Let's look now at 4 cranial sutures. The coronal suture, think of the coronal or frontal plane that we said would go down through the crown of the head and give you an anterior and a posterior section. So now we're looking at the coronal suture. The coronal suture connects the frontal bone to both of the parietal bones. The second cranial suture is the squamous suture. So think of simple squamous epithelium or stratified squamous epithelium. Squaw was that flat, irregular shape. So the squamous suture has kind of an irregular shape to it as well. The squamous suture connects the parietal bones to the temporal bones. There will be a squamous suture on the right side as well as the left. Sagittal suture follows the same line as a sagittal cut. Sagittal cut, remember, gave you right and left halves. You can see in this picture the coronal suture up here. So this would be our frontal bone. These would be the parietal bones, so the right and left parietal bones connected by the sagittal suture. The final coronal suture is the lambdoid suture. The lambdoid suture is at the base of the skull. It connects the parietal bones, so here we have the left and the right parietal bone connecting to the occipital bone through the lambdoid suture. The lambdoid suture, my hint is to think of the lamb part of it. And the nursery rhyme, Mary had a little lamb who followed close behind her. So that helps me remember that the lambdoid suture is going to be the one that's on the posterior side. And that does it for cranial bones and the 4 sutures.